Turning now to the images of starving children coming out of Gaza and how the situation abroad is impacting families and aid groups here locally.
Our Sabrina Franza spoke to people who are working to raise awareness about what's going on and happening on the ground. And Sabrina, they say their family, or in some cases their clients, need help right now.
They need help now. They need help yesterday. Both aid groups and family members are describing the situation as the worst it's ever been. There have been some trucks filled with supplies that have entered the region today, but even that, they say, is just a drop in the ocean compared to the starvation. And we want to warn you, some of the images you're about to see are disturbing.
So this is my maternal aunt, Yasmin Asfour, and these are her 5 children.
William Asfour says many of his relatives,
her husband was a doctor,
have died in the conflict so far.
He was killed in October of 2023. The trauma is, heavily layered. You can see the pain in their eyes.
Now he worries his surviving family could starve before aid gets in.
They're rationing off of expired canned goods. They are surviving on lentils. They're making it stretch. There's people who haven't had bread in several days.
The feeling being in Chicago while this is happening abroad.
I have this survivor's guilt here in America.
For him, there's a simple solution.
All this can stop if Israel just allows the aid to go into Gaza.
After international pressure, Israel announced humanitarian pauses to allow more aid in. Today, some trucks carrying aid moved through this gate at Rafah border crossing, though these trucks make up a fraction of those waiting to deliver food and supplies.
It's not a logistical problem. It's not because we don't have capacity to do it. We've got aid workers on the ground in Gaza who are mobilized, who have the capacity as soon as we get permission.
Anastasia Moran works for Med Global. Their teams have been in Gaza delivering medical care to about 4,000 patients, especially expectant mothers and children.
In the last month alone, we've seen a tripling in malnutrition cases in our clinics.
Cases like these.
In that end stage of malnutrition, what you think of when you see those awful images of kids that are skin and bones, that's what we're now seeing more and more of.
She says they're running out of supplies. Their trucks have not gotten permission from Israel to deliver.
Those kids, food doesn't help them. I mean, it's too late. They need medical care. They need specialized nutrition services that we can provide. They need professional aid workers and health workers who know how to treat those cases and save those kids' lives.
Now, in terms of how families at home can help, donations do allow groups like Med Global to mobilize quickly and bring in perishable goods as soon as they get that okay to do so.
Okay, Sabrina, thanks very much.